rich anywhere to make a dent in the government's costs. It's the vast middle class in the United States that's the only source of the kind of money that national programs like government health care require. A simple example of this was the fact that Hillary Clinton's infamous program rested squarely on the backs not of big business, but of small businessmen who were struggling at the time merely to stay alive and in existence. Under any socialized program, it is the so-called little people who do most of the paying for it, under the senseless pretext that the people can't afford such and such, so the government must take over. If the people of a country truly couldn't afford a certain service, for instance in Haiti, they just couldn't afford it, then for that very reason, neither could any government in that country afford it either. The idea that the government can afford it but the people can't is bizarre. But of course we're taught today that you don't have to go by logic, so the more bizarre, the more you can get elected preaching it. Is it true that some people can't afford medical care in the U.S.? Absolutely. But they are a small minority in any free or even half-free country. If they were the majority, that is, the people who can't afford medical care, then the country would be utterly bankrupt and couldn't even think of a national medical program. And as far as this small minority is concerned, properly, morally, they have to rely solely on charity, private, voluntary charity. Yes, I'm talking about the kindness of the doctors or of the rich. Charity, not right. In other words, because they can't pay for their health care does not mean that they have a right to the lives or works of others. Because I'm sick does not give me the right to take a gun and point it at your head and say, I'm going to blow your brains out until you make me well, or until you give me the money. Where does sickness give people the right to claim to hold a gun to somebody else's head? And yet, when you appeal to the government, you're talking about appealing to a gun. That's the only power the government has that nobody else does. It can throw you in jail. It can send soldiers and policemen, grab your assets. All of that is symbolized by a gun. A government has the monopoly on the use of physical force. To appeal to government as a solution means to appeal to physical force as the solution. To say, I'm too poor, so the government has to do it, means I'm too poor, so I'm going to shoot somebody else or threaten him. And I would like any caller in Southern California or in the entire face of this globe to tell me how his sickness gives him a right to hold a gun to somebody else's head. Now, charity was always forthcoming in the past in America. For instance, the advocates of Medicaid and Medicare under LBJ never claimed in the 60s, I was there and I heard all the garbage that went on to get Medicaid and Medicare passed. They never claimed that people got bad care, that the poor or the old were suffering. They claimed that it was an affront for anyone to have to depend on charity. And so they decided that the way to abolish charity is to call it something else. If a person is getting health care for nothing, simply because he's breathing, he is still getting charity. I don't care whether or not some politician calls it a right. To call it a right when the recipient didn't earn it is merely to compound the evil. It's still charity, although now it's extorted by criminal tactics of force while hiding under a dishonest name. That is Hillary Clinton's contribution to the clarification of the world situation. And with that, Dr. Peter Laporte, we are honored to have you.
Yes, I'm here.
You are the head of this organization, AFCAM of Rich Doctors, right?
Oh, absolutely.
What can we do for you?
I was interested if you'd like to hear a horror story of what is actually going on in medicine today.
You're a doctor in practice, right?
A surgeon.
You're a surgeon.
Yes.
Are you allowed to say where this horror story took place or not?
Well,
You'd rather not?
not.
Okay. Is it fear of the hospital or fear of the government?
Both.
Okay. Now, that's a good idea of the climate under which doctors live. Tell us about this. Is this a recent horror story?
In the last 6 months.
And this is a true story in Southern California?
That's correct.
And this could happen to the people listening to the program?
This is happening every day, whether people want to believe it or not.
Okay. I'll give you the mic.
A patient came in, 67 years old, on one of the HMOs that Medicare allows them to pay the HMO instead of Medicare taking care of the patient. And the patient was completely functional until the day he got sick, came in the hospital. They treated him. The primary care physician treated him for 2 or 3 days before they finally called me. By this time, the patient is almost moribund, needed to have an operation, but also was going into renal failure, so I need to call 2 other specialists to see him and have the patient operated on within 8 hours.
Now, this is an HMO patient.
This is an HMO patient, but under Medicare.
Right.
Well, they decided that was not appropriate.
They couldn't afford a specialist.
Essentially, well, now they didn't tell me that, but that's what was going on.
Right.
They went to the family and said that this patient was already too sick and that we shouldn't do anything. They came to me and told me afterwards that they did that. And by the time I raised enough hell...
You mean they were just going to let him die to save money?
That's correct. They made a medical decision that he's too sick to be cured.
Now, what would have happened in the old days of private fee-for-service, greedy, selfish medicine if you had a patient like this and he didn't have the money for a kidney expert?
The physician would have come and seen him for free.
Absolutely. And you know why? Because not everybody in the world had his hand out demanding something for nothing. So the people who were really poor were a small minority, and they got fabulous service. My father was a surgeon, and he used to give his time away for free to the poor all the time. And the moment that they passed socialized medicine in Canada, he moved to the United States. So I know exactly what you're saying. Did this guy die?
This guy then died.
He actually died.
He died. And
what did the HMO or the government people say when you told them?
Nothing. They just said that that's the judgment of the other doctors who are the gatekeepers. And
there's no board of appeal to this?
No, there is no board of appeal. Actually, if you complain, if the primary care physician complained that this was not the way he wanted to have it done, he would have been fired from the HMO.
So, I mean, they're put in a position where the doctor's ability to survive depends upon keeping quiet and taking orders and looking the other way, while the people that are entrenched in power by the government make decisions as to whether the patients will live or die.
Right. To put it in real terms, I have to decide whether I want my kids to go to college or keep my mouth shut.
That is really horrifying, and I know we're going to have you on our panel, and I'd really love to find somewhere in Southern California somebody connected with an HMO who would come out in public and stand up, sit down on this show. We'll give you unlimited time, perfect politeness, tea and coffee, whatever you want. I'd like to hear from one of you HMO people out there that would have a debate about this subject and air some of these charges. Is this all really unfair? Are you all really terrific preventive health organizations, and you're not in bed with the government and certainly not to your interest to kill off the patients? I'd like to hear about it. I just would like to say that Dr. Laporte's story reminds me that in Britain, with socialized medicine, our first caller, Ryan, was all for emulating Britain. When patients reach a certain age in the 60s, I'm not sure exactly, 62, 63, even though they have conditions for which there is definite curable treatment, the family physician, as a matter of course, tells the gentleman, sorry, sir, there's nothing we can do for you. Here's some medicine to make you feel better. Go home and die. They do that as a matter of national policy because they claim it's not worth it to spend all that money, for instance, on a heart bypass operation for a guy in his 60s. So what? He'll get another 10 years of life. We'd rather spend the money breeding bureaucrats at Oxford University so that we can really get something for Britain. That is the way this system actually operates in England right now, for all you people who are so eager to have it operate here. Martin, welcome to the show. What do you think?
Hi, how are you?
Okay, I'm mad right now.
Are you mad?
Yeah.
What are you mad about?
I'm mad about health care. Why? What are you calling about? Health care, presumably, right?
Well, yeah, it's something to do with health, but the main thing is, you see, what's structuring thing is money. It's how much money you have. Now,
well, you think the rich control the world?
Well,
they're sure doing a bad job of it then, because they're sure taxing themselves out of existence.
70%, what I've heard, 70% of the people visiting the county hospital are illegal immigrants.
Are what?
illegal immigrants.
Illegal immigrants.
And pay nothing.
Well, that's certainly very wrong, but what is the solution? Socialized medicine?
Well, no.
What do you think the solution to that is?
Well, the solution is, I don't know.
I have an obvious solution.
What is that?
The obvious solution is let's stop giving away medical care free to anybody. Americans won't therefore get it free, and immigrants won't get it free, so nobody will move here in order to get free medical care. Isn't that an obvious solution? Make everybody pay, American or foreigner. Then everybody's going to have to work for what they get, and there won't be hordes descending on us saying we're poor.
Now, how is it that they show up in these county hospitals? They just appear there. They drive there in some kind of car.
Yes, they do.
Must get there in some kind of car or have some kind of transportation.
I don't know, unless Clinton has a system to get them there so that they can then vote for him.
No, Clinton basically wants...
I'm just kidding, yeah.
Right. Now, what we're talking about is money, right?
Well, no, I don't think we're talking about money. We're talking about ethics. Because this country is or used to be loaded with money, but we're talking about the fact that there is a certain mentality in this country which says it's the moral duty of those who have money to give to those who don't. And the government is the agency to channel the money from the haves to the have-nots. That's what attracts the have-nots from around the world to come here for handouts. And the only way around that is to say, money is wonderful if you earn it and spend it on yourself, and let's stop feeling that we have a duty to give it to the have-not. So I say the issue is not money, but ethics. Listen, Martin, I got to go to a commercial. Thanks very much for calling. It's 3:19. My name is Leonard Peikoff. We're talking about health care. And a rhetorical question, how come all you people phone in the last 10 minutes of the show instead of earlier? We get flooded with calls when we're going off the air. But, Sally, we have time for you. At least, how are you doing today?
I'm just fine, Dr. Peikoff. I was just wondering, I listened to Dr. Laporte about the patient who died, and I was wondering if you think maybe it's the patient's responsibility because he was looking for something for nothing, for the health care from the HMO and all the rest.
Well, I don't think it's the patient's responsibility unless he's the type of patient who spent his life agitating for government programs. Then the man got what he asked for. But the typical person in this country worked for a living. They got sucked into this system of Medicare. The currency has been inflated by the government to the point where it's impossible to save anymore. So you're pauperized by your own government. By the time you stop working, you have no money, basically. They throw you into this medical health care system, which is designed to kill you off. You can't blame the people for that. Absolutely, I don't think so. Now, if it's a young, able-bodied guy and he walks into, a something-for-nothing scheme with his eyes open, he deserves what he gets. But I don't think that people in their 60s today are guilty. They're the hard-working people that have worked all their lives, and they're trapped by a lousy government. Does that answer you?
Yeah, I think that makes sense.
Okay, thank you, Sally.
Thank you.
Jan, how are you doing?
Just started listening to your show, and I love it so far.
Well, I was going to say, why didn't you call a half hour earlier? Everybody calls in the last 10 minutes for no reason known to me.
Yeah, well, I think you probably hit on a hot topic there. But, my only child was injured critically in an auto accident and ended up dying.
Oh, I'm sorry to hear that.
No, thank you. But it really kind of aggravated me, to see the level of care. She was in intensive care, critical care, for 10 days. Mm-hmm. But to tell you the truth, it's a very large, well-known local hospital. Now, I work full-time. I have a health plan and, have had for years and have an HMO. And they were responsible for the tab. But it's like it was very weird that I got the overwhelming feeling that the decision to basically let her go and to give up on her, which was really being pushed by the hospital, seemed to be financially driven.
You mean you felt that there were medical actions that could be taken to save her, and they wouldn't take them?
Somewhat, yes.
Did you have another doctor? Could you afford bringing another doctor in as a consultant to fight your case with them?
Well, she went into multi-system failure. And at that point, they were probably right. I mean, I'm quite sure that they were, that, there was nothing more that they could do, but they advocated, pulling the plug.
Well, you think they did it too fast?
I think that I got the feeling almost like this is sort of like a meat wagon or an expressway to, for a plant,
I don't know any of the details of